Major movement in the healthcare industry as the new administration begins to try to, quote, make America healthy again. The Independent Medical Alliance says it involves a vision for transparency, reform, and trust. And joining us right now with more is Dr. Chris Martenson, Senior Fellow in Toxicology at the Independent Medical Alliance. Good morning to you. Thanks for joining us, Doctor.
Good morning, thank you.
How can you restore trust and transparency with patient-centered care and without any corporate or government influence at this point?
Jan, that is a great question. And, you know, it starts with the fact that the IMA was originally founded in the earliest days of COVID by a group of caring, passionate doctors who were alarmed to see their specific institutions and maybe their profession more generally abandon the practice of medicine. And instead, they were following NIH, FDA, CDC, patient care instructions that sadly were either ineffective or in some cases actually deadly. And now those instructions, look, they may have been well-meaning at the outset, but the corporate and government influences involved, they prevented them from adjusting, and worse, over time, a pattern developed. We saw that expensive on-patent medicines rose to the top of the list, and potentially effective and very safe off-patent medicines, somehow they got blocked in this whole process. So we watched this happen over and over again, and we realized there's a pattern going on here. And so look, the IMA seeks to restore this lost trust, and it has been lost, by continuing to do what we've always done. We put the patient's needs first, the patient care comes first, the patient wishes, operating with complete transparency so we can have actual informed consent, and we're advocating for doctors to be allowed to be doctors again.
What are the key barriers to honest and uninhibited medical advice today? How can your organization support doctors and patients in rebuilding that trust?
Well, honestly, it's just going back to where we used to be, which is doctors practice medicine.
Right.
So what do we stand for? Three things, right? We got to promote full data transparency where patients have access to all the data. We did not see that during, say, the COVID vaccinations. People were not given full information. So people should be allowed to make their own decisions. That's the essence of patient rights. You have the decision to how you want to be treated. You know your body best, we feel. And we're standing against health mandates. Mandates, often they're just clubbish, that they're not individually tailored. So we stand for that informed consent. And then, you know, we think that all the doctors and all the patients should have all the tools and the right to examine everything to make up their minds. And we found that this is the transparency that's been lacking to date. Key data has been withheld. We have to pry the information out of the CDC or the FDA, and we're against that. So we think full transparency, let people make decisions, and we trust that doctors and patients are going to come to the right decisions for them.
And what role do you see your organization playing in really shaping this national policy?
Well, we're going to do everything we can. Look, a great question. You know, Jan, I thought I was a very sophisticated, if not even slightly cynical medical consumer. I've been through medical school, the whole 9 yards. COVID opened my eyes to what was really transpiring here. And so what did we find? We found that money had the largest seat at the decision table. And we see now Bobby Kennedy Jr. coming along and saying, well, look, we think science should also have a seat at that table. We stand behind that 100%. We're evidence-based organization. And so to really restore that trust, we're going to have to see, as consumers, as doctors, as patients, that, look, we're making decisions based on the best available data we have. That sadly has not been the case for a very long time. And so this is a breath of fresh air. We actually have a moment here to do something that can reverse the worst chart you could ever look at, which is Americans' life expectancy against how much we spend to achieve that life expectancy. We are the worst of every developed nation by far. Lowest life expectancy, twice as much expenditure. We know we can do better. And that begins by making sure that money takes a second seat at the table. Let's just get back to what medicine should have always been: evidence-based and rational.
Dr. Chris Martenson, we appreciate you joining us this morning. Best of luck to your organization. And by the way, for more information on the Independent Medical Alliance, you can check out imahealth.org. Thank you.